Thanks for using BMJ on Examination's Situational Judgement Test resource to make sure you fly through this exam. Here are 3 quick facts about the structure of the Situational Judgement Test. Firstly, it consists of 70 questions in total, sat under exam conditions, taking just over 2 hours and 20 minutes. The exam itself consists of 2 different types of questions. Firstly, a ranking question where you rank options from best to worst out of between 1 and 5 rank score. The second question type is choosing 3 answer options which work together out of a possible 8 answer options. Thirdly, this test is really important. It consists of over 50% of your final foundation program scoring, which helps to choose which jobs you will go into as a junior doctor. The SJT score is also important because it's used as a tiebreaker if others have the same score as you for deciding what job will be allocated to what person. Here are some general tips for the Situational Judgement Test. Firstly, as well as on Examination's fantastic SJT resource, make sure you do the 70 example questions provided by the Foundation Programme on their own website. These are core questions for you to practice and also digest the explanations in detail. You should become hugely familiar with the General Medical Council's Good Medical Practice document, which underpins many of the questions in this exam. Not only that, but you should also read in detail the explanatory guidelines provided from the General Medical Council. These important areas covered include confidentiality, consent, and addressing concerns. As well as the General Medical Council's document, this exam is based around the 5 domains needed to become a safe, efficient doctor. These domains are commitment to professionalism, effective communication, a patient focus, working efficiently as part of a team, and coping with pressure. Here are 3 tips for answering the rank order questions in the Situational Judgement Test. Tip number 1. Make sure you read through all answer options before starting your ranking. Tip number 2. Some find it easier to start with the least appropriate option, ranking that the lowest and working backwards. Tip number 3. If ever you are deciding between 2 answer options, always choose the option which will be safest for the patient. Being a doctor is about being patient focused, and that should be at the prime of your concern. Here are 3 tips from choosing 3 options from 8 in the Situational Judgement Test. Firstly, make sure you choose answer options which can be delivered together. Answer options cannot compete against each other or cannot be incompatible with each other. They must work together as a whole. Secondly, try to put yourself into that very position that the question is asking of you. You may have encountered these scenarios throughout your rotations and clinical work, and if so, make the most of that experience. Thirdly, practice, practice, practice. Get used to the style of questions, the difficult dilemmas that they often present you with, and use the guidance questions delivered not only by the Foundation Programme itself, but other resources including BMJ's Situational Judgement Test. From the BMJ and on Examination, we wish you the very best in your Situational Judgement Test. It's an important exam which will decide the future of you as a junior doctor. Good luck.